Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
We're going to keep the intro very brief here because we have a very exciting presentation coming up for you all. It is about skin cancer, the hidden threat you might not expect, and it will be delivered by Dr. Tanyaponn Puttisri. So without further ado, Dr. Tanyaponn Puttisri, skin cancer, the hidden threat you might not expect.
Good morning, everyone. My name is Dr. Tanyaponn. I'm a dermatologist at Bangkok Hospital Pattaya. I'm specializing in the diagnosis and the treatment of skin diseases, including skin cancers. Living in Pattaya, I have the opportunities to work with Thai patients and international patients from all over the world. Pattaya is a nice city with beaches and the sun shines almost all year, so protecting our skin is also very important. Skin cancer may sound frightening, but with the right knowledge and early detection, it is one of the most preventable and treatable disease. Today I would like to share you with the key facts about skin cancer, how to recognize it, how to lower your risk, and how we staff at the Bangkok Hospital Pattaya will help support you in keeping your skin healthy. So what is a skin cancer? Skin cancer happens when abnormal cells in the skin start to growing out of control. Normally, old skin cells die and new ones replace them. But in skin cancer, this process breaks down and abnormal cells invade the normal tissue, and sometimes can also spread to other parts of the body. There are many types of skin cancer, but these are the three most common ones that we find. The first is BCC, or basal cell carcinoma. The second is squamous cell carcinoma, or SCC, and the third one is the melanoma. And these three can behave differently and manifest differently. Let's start with basal cell carcinoma. Basal cell carcinoma located in the lower part of the epidermis. It most often develops in the sun-exposed area, especially on the head and neck. Basal cell carcinoma doesn't only have one look. It actually comes in several different forms. The first one is the nodular basal cell carcinoma. This is the most common type. It will appear as a round or pimple-like bump, and when you look closely, you can see like the visible blood vessels. Okay, like this one, it looks like a bomb, the pink bomb that never go away, and sometimes when you look closely, you will see like this tiny blood vessel. The second type is the superficial spreading basal cell carcinoma. This one looks like the red lesion, and that never heals. Sometimes may look like eczema, but the border is quite well defined. This one mostly found in the trunk, arms, and the legs. The third form is the sclerosing or morphiform basal cell carcinoma. This one is quite tricky because it appears as like the scar that it expands over time, and most commonly is on the face or is on the trunk, and sometimes can appear like the small red dot. And the last one is the pigmented BCC. This one may look similar to the mole, but it's normally like elevated nodule. But if you look closely inside the edge, it's like elevated edge. Okay, so the sign and symptoms of basal cell carcinoma is the first is like you will have the lump or bump on the skin that never heals. The second is like the shiny skin color bump that looks translucent. And when you look closely, you see small blood vessels. The third one, as I tell, is like brown, black, blue lesion similar to moles, or can be like flat, scaly patch with a raised edge. can present like scar-like lesion, but you don't never have the scar on that area before. And normally cancer sometimes can cause itching or pain, but most of them doesn't have any symptoms. The next is the squamous cell carcinoma. This one is the second most common type of skin cancer. It begins in the squamous cell, which is on the epidermis or the outer layer of the skin. This one usually also form on the area with high sun exposure and can also be found on the mucous membranes like mouth or tongue. The type of squamous cell carcinoma is cutaneous SCC. This one can be found on the skin. It will present like an ulcer that never heal, and sometimes can present like the thick yellowish crust. And this one is dangerous, more dangerous than basal cell because it can also metastasize to the lymph node and to other organs, especially if it's on the mucosa area, sometimes can spread quickly than on the skin. Okay, so symptom of the SCC that I will tell you is like the rough, scaly bump that may have the crust in the middle, or can be like an ulcer that keep getting larger and never heals, or sometimes can be like a growth from the skin or depression in the skin. And the third one, this one is quite tricky because it's present like the flat, red, scaly patch that often larger than 1 inch. Next. Okay, this one is the most dangerous one, or melanoma. This one developed from melanocytes or the pigment producing cell in the skin. And this one can normally appear as the moles that have some component that looks irregular, and it can also just appear on itself or can develop from the mole you once already have. Actually, melanoma is quite dangerous because it can spread to other area of the body, for example, to the lung, to the brain, and can cause death. But the thing is that melanoma, if you have the early detection, is highly treatable. Sometimes just only the surgery and is finished. Okay, so this is the one point that I want to emphasize, how to recognize melanoma. I want you to remember ABCDE rule. The first A is stand for asymmetry, or it's like if you draw the line, you cannot, one side doesn't match the other side. The second, the B is the border or the edges. Melanoma will have like irregular edges. The edges will not be smooth. And color, the color in melanoma is like uneven color. Sometimes in the same lesion, we have both brown, black, gray, red, or white. So if you observe some lesion with many color in just one spot, then you may need to come to check. The D is the diameter. So if the lesion, the diameter is larger than 6 millimeter, or you can compare with eraser at the end of the pencil. If it's larger than that, then you may need to come to check. And the E is evolving. It means like the spot is new, or it's the same old spot but change in size, shape, or color. Okay, we already talked about the cancer, but before the cancer develops, then there is some process before becoming cancer. So I want to talk about non-cancer, but we call another thing is pre-cancer, or the process before it becoming cancer. This is very common. It's called actinic keratosis, or AK. AK is not a cancer, but it's considered the precursor of the squamous cell carcinoma. AK occurs on sun-exposed area, for example, on the face, on the forearms, and precancerous means like some part of the cell starts to change to be malignant. Similar to the precursor of the cancer, but it's not the cancer yet. But if you leave for a long time, sometimes it can develop into squamous cell carcinoma. And yeah, as I tell, it's often occur in sun-exposed area. Okay, so signs and symptoms of AK. You go back. Go back to the last. The way to observe AK is it will present like the pink, small spot, or red, and sometimes it will be like some small, tiny scale or crust that sometimes keep falling and then just grow back over and over again. This is a sign of AK. And other things that can occur with AK is like sometimes there will be the thick crust, can be yellow or brown on the top, sometimes can bleeding, and sometimes can have other colors, for example, like can be red or pink, or can be even the same color as your skin, and sometimes can have burning or stinging symptoms. Also, AK can also occur on the lips, for example, may present as dry, scaly lips and loss of color in the lips. Okay, and now the risk factor for skin cancer. The first one is the skin that got sunburned easily. So if when you're young, if you got sunburned often, or if you have the very fair skin, or if your natural hair color is blonde or red, or if you have light eyes like green or blue, or you have a lot of freckles, you are more at risk to develop skin cancer. The second is the ultraviolet light from the sun. The frequent, for example, like the strong UV area and the intense sun exposure can increase the risk. The third is a history of skin cancer. If you once develop skin cancer, you are more likely to develop it again. So make sure if you have, you need to come to have a check more often than other people. The fourth is the family history of the skin cancer. If you have your parents or siblings that have skin cancer, then you are more likely than other people to develop the skin cancer. And the five is the weakened immune system. For example, if you have the organ transplant or have some autoimmune disease that need to take immunosuppressive medicine, then your immune system is weakened and you are more likely to develop the skin cancer or some infection that cause the low immune like HIV infection. The prevention of the skin cancer is, the first is to avoid the sun during the midday. I recommend avoid in Thailand, it would be from 10 to 4, which is the period with a very strong sunlight. And use the sunscreen all year round. Sometimes even on the cloudy days, the UV is still penetrating and can damage your skin. I recommend to use the sunscreen with SPF 30 to or can be 50. And applied, you need to apply before going out in the sun for around 15 to 30 minutes and let it bind to your skin first before going out, and reapply if you sweat a lot or swimming. And third, wear protective clothing, for example, the hat, especially if you have few hairs, then you need to wear some hat. And check your skin regularly. Look for some new growth or change in your mole, your freckles, or your bumps, or even your birthmarks, and report the changes to your healthcare provider. Okay, now I will talk about the treatment. The treatment of skin cancer depends on the type and the stage of the skin cancer. In some case, for example, just if it's very small, just the biopsy alone can remove the whole lesion and no need to do anything else. But if it's big, it may need to require like bigger surgery. Okay, so here we normally use combined treatments. Okay. The treatment we have here, the first is the cryotherapy, or we use very cold liquid nitrogen and with the spray to freeze the skin. This one mostly used for the actinic keratosis or precancerous lesion. After freeze, and then you kill the dead skin and it will, kill the abnormal cells and it will fall off. And also can be used in some cancer, for example, superficial basal cell carcinoma. We have here in the Bangkok Hospital. The second is the excisional surgery. This one we will cut out the tumor and then have the stitches to make sure that, and we make sure that all the margins are free of the cancer. The third one we also have here is the Mohs surgery. Mohs surgery is will remove only the diseased tissue, and this one the advantage is that to make sure that all the cancer is clear and to spare the tissue as much as possible. These three we have in the Bangkok Hospital. The fourth is curettage and electrodesiccation. This one is like using the loop instrument to scrape away the cancer cell, use electric needle, but this method, actually the recurrent rate is very high, so we do not do this here in our hospital. Chemotherapy. Actually there are two forms of chemotherapy. The first form is the topical or the cream. We have the imiquimod cell, which is the chemotherapy cream. You can apply it on the actinic keratosis 3 times a week for 8 weeks, and it will kill the abnormal cell. Other is like IV chemotherapy, this one for advanced. Immunotherapy, radiation therapy, this one also from for the advanced stage, so we will not talk about that today. Okay, so the point of the skin cancer is it may sound dangerous, but if you are aware and have it checked, and when we detect at the early stage, it can change from the life-threatening skin disease to just a simple treatable disease. So thank you very much, everyone, for coming to listening to me today. And remember, if you doubt any spot, just come and check. Thank you. Sure.
Well, very insightful. Thank you very much. Now, as you all know, we have some time for Q&A. So if anyone has questions for the doctor.
I work in the sun, and then I come here often. I get checked every 6 months. Can it spread? Is that a good time to a good distance for getting checked if you're in the sun every day? Because my doctor says, maybe 3 months, but I think that's too soon. What do you think about that?
I think it depends on the person individually. Like if you once already have skin cancer or you have a lot of problems, then you may need to check like every 6 months. But if your skin is quite normal and every time you come to check, not many problems, so annually is enough. Or if your skin type is very not have any mole, not have anything, then can just come in time when you are in doubt.
Okay, thank you.
Thank you.
Sorry, I have a question. What in Thailand, to become a skin cancer, what normally is the path to become a skin doctor for cancerous dermatologist in Thailand?
You mean being how to become like...
Yeah, the professional path from the studies to become a dermatologist in Thailand.
Oh yeah, first after finish high school, and you need to apply for medical school and study there for 6 years. And after that you have to go to work in the hospital outside to gain experience for at least 3 years. So after 3 years you can apply for dermatology specialist and study in dermatology for another 3 years.
I've been using liquid nitrogen to remove spots from my skin, but the lady who's doing it uses a Q-tip to apply it. Is it any different from using a gun or the Q-tip, or does it make any difference at all?
The Q-tip, the good thing about the Q-tip is very accurate and also spare the normal tissue around. So using the Q-tip is maybe more safe, but it may need to apply a little bit longer time than, because the power of killing the dead cell is maybe not as strong as the open spray.
Hi, Dr. Tanya. My name's David. I'm a doctor from Australia, and so I've worked as a general practitioner and emergency for 25 years. And your talk was fabulous. I thought it was very thorough, and if I went to a talk as a doctor in Australia, that's what we would hear. So it was very comprehensive. I want to say that to everybody, that she gave a very comprehensive talk, and there's nothing that she's left out. And it's something that, for us older guys, we do become relatively immunocompromised, partly because we're aging and it's sunny here. And it's something that we should all do, is get regular skin checks. And how often depends on our skin type and, you know, other risk factors, like Dr. Tanya is saying. But all I can say is that it was a great talk. I just wanted to say thank you again. It was very good, very good. And yeah, it sounds like, the thing is, if you go to see a dermatologist and they're not in a proper skin cancer centre, like in the Bangkok Hospital, then there's a chance that they may not comprehensively go over your whole body and have all the backup. So it sounds like this is one of those things that's probably worth doing regularly for everybody.
Thank you for your presentation.
Thank you.
I was curious, are you a Mohs surgeon? A Mohs surgeon, are you a Mohs surgeon?
Mohs surgeon is another colleague of mine. She graduated in specialized surgery, so she can perform Mohs surgery in Bangkok Hospital.
Thank you.
Thank you, Doctor. Just a brief question. My wife is a bit Thai, and any blemishes on her skin, she definitely wants to go to the hospital. She has these little white spots in different places, and she's worrying the hell out of me. Can you explain to me what the problem is with her skin? She doesn't go into the sun at all. If she can cover herself up with all sorts of creams, that's quite nice. You know, sometimes when I squeeze her, she slips out of my shoulder.
So the question is, she has some white spot on her body? Yeah. It depends. Some small white spot in dark skin people sometimes can also occur from the age, but it depends because there are many types of skin lesion that can present as the white spot. For example, vitiligo, some infection like some type of fungal infection can also present as the white spot. So if not sure, then she can come to have a check.
I'm kind of torn between the zinc sunscreens and they go on white, and then the regular sunscreens that have the toxic ingredients. Does the zinc sunscreen completely keep you safe from skin cancer, like the white zinc sunblock?
The zinc is the physical sunscreen. Actually, sunscreen we can divide into physical and chemical. And physical sunscreen is protect all length of light, but chemical sunscreen will protect from UVB mainly, and some of the UVA wavelength. Physical sunscreen, in terms of prevent skin cancer, I think not much different, but the thing that is better for physical sunscreen is that it can protect from the visible light, and visible light sometimes can cause some pigment change on the skin, so that's the benefit of the physical sunscreen. And also some people who have allergic contact to the chemical sunscreen, then physical sunscreen is the better choice.
Thank you.
Thank you, doctor, for that. If I may ask, you said about 10 a.m. to 4 p.m., stay away from the sun. What do you advise to all these white-skinned expats or whoever wanted to get the tan?
I think apply proper sunscreen. I think, yeah, apply proper sunscreen. Yeah, apply proper. I mean, if you really want to get the tan skin, just make sure to apply the proper sunscreen and maybe choose the period that is not too strong.
Thank you very much, Dr. Puttisri. Before you go, would you take a photo? I will present this.
I got a good iPhone Pro Max.
Lucy's coming down, Eric. Eric.
There we go. I'll do this one. Okay, long, song, Sam. Okay, and again. Long, song, Sam. Okay. Okay, I'll send it to you. The official. Okay.
Before we go on, actually, we have another person who would like to give a quick talk about hospital-related matters. So please welcome our next presenter.
Thank you. Hi, good morning. My name is Basal. I'm the head of International Marketing Department. Today, I would like to have a chat with you quickly to introduce our newly membership card that's specifically designed for our expat community. So this is our membership card that valid for 1 year. This costs 2,900 baht, and the benefit is you will get 10% off the medicine, 20% off the room rate, and apart from that, you will get the complimentary check-up package worth about 6,000 baht with this package as well, with this membership card, which is valid 1 year. Apart from that, you will get a special discount with our partners such as hotels, spas, the attraction, the cafe. When you present this card, you can get the benefit that they offer. So this will be beneficial for those who doesn't have the insurance, or if the insurance doesn't cover. So if you have to pay by yourself, you can get the little extra discount with this package. And also with the check-up package that comes with it. This is the general check-up package that you will get when you spend 2,900 baht with the membership card. It have the blood test for cholesterol, sugar, kidney function, liver function, and also we have the uric acid test and urine examination, chest X-ray, and echocardiogram, which is like basic checkup that you should have like once a year. So this will come free with the membership card. So this is what we would like to introduce to you all today. So if you have any interest, you can scan the QR code to apply, or we will send the information to Len, and then he can distribute to the members, so you can apply for it online. Thank you very much for your time.
That sounds really good. I'm wondering, can you apply using a credit card?
Yes.
Okay.
You can apply online and pay by credit card. Yes.
All right.
And we will send you the digital version of the membership card to you by email, and you can just present that at our partners. Because we will note on your track care system, our hospital system, that you have this membership. You don't have to show any card when you visit the hospital.
Why isn't it, or could it be that Thai people can get the same thing?
Yes. This is designed for expat and the Thai, so for domestic people, so for yourself and for your Thai family as well, the partner, your kid, your family. Yeah, this card applies to both expat and the Thai, so the Thai also can purchase this one. And the checkup that comes with the membership card is transferable. So if you already have your benefit checkup package already, so this one you can give it to your friend, your family, or somebody else that you want to have this checkup. It's valid 1 year as well. So your card is valid 1 year after the date of on the date of purchase. So the checkup is valid 1 year too. Okay. So is there any more question you can ask us at any time? You can email us or give us a call. We are happy to answer all the questions that you may have. Thank you.
Thank you for that special presentation.